Do you have insufficient rest, body aches, low energies, and feeling tired all the time? Pain on your muscles and joints? Often need to pop pain relief medication? Over-exercise or under-exercise? Need to go for physio, chiropractors or body massage? Headaches or tension or stress? Myofascial therapy is emerging strongly in this pandemic, and the potentials of healing benefits are huge. Myo refers to your muscle fibers, whereas fascia is your connective tissue. Located directly between the skin, joints, muscles, or tendons, the fascia is a flexible and stringy tissue. It is very strong with its web-like flimsy membranes that separates every muscle in the body. If you have muscle soreness from over-exercising, or your body is contorted into tense knots from inactivities by sitting at your desk, a myofascial therapy will help to get rid of the knots and allow you to feel spacious, light, and relaxed. Many people adopt myofascial therapy as an alternative option when they notice the persistent pain that doesn't dissipate even after icing, heat, or rest. You will feel relaxed, rejuvenated, and lighter in those muscles, joints, and tendons after each therapy. The immediate feeling of relief will last up to 24 hours after each treatment as the body flushes the toxins and impurities. Do take note that your muscles will be activated again the next day when you start moving. Suffice to say that your postures, habits, lifestyles, and activities plays a part in your everyday affair. If these knots are unattended, it may turn to chronic pain. Muscles will cause limited range of motion, pain, and tightness until they are released from loosening the fibers as the circulations will return to the constricted area. There are many techniques you can use in self-myofascial therapy, whether you are stressful executives or seniors that require modification. Research by Korea University Institute of Health stated that with an advancing in age, the prevalence of musculoskeletal pain will increase to 40 to 60%. When unattended, this pain will result in disability, immobility, work capacity, and financial burden. Myofascial trigger points, or MTRPS, are hypersensitive spots within a taut band of skeletal muscles and cause traumatic injuries or repetitive micro-traumas through chronic prolonged muscle overload. It is one benefit to release inflammations where blood is constricted in the trigger points. If you delay getting your treatment done, there is a lack of oxygenated blood, prana or chi over time. And given our busy lifestyle, it is often oversight. The basic TCM concept is simple. If there is chi or blood stagnant in the channel, there will be pain. Integrating the Eastern TCM acupressure points will enhance the flow of the qi in the body. Sports professionals to ordinary folks often have shortened and tight muscles on your quads. These pains are the wake-up calls as it affects your knees, hip flexors, and the TFL. In your prone position, place the ball in the middle of the quads and apply pressure compressions. Flex the knees as it activates your quads muscles where Futu, Yingshi, Liangqiu, and Baichongwo are located. Gently massage the quads by dividing it into 3 sections above the knees, middle of the quads, and to the top that near the groin. Bad sitting posture, prolonged inactivities, contorted body alignment, over-exercising your hip and IT band can cause sciatica nerve pull, tension on your outer hip. Place the fascia wall on the outer hip and massage through to the outer thigh and butt cheeks. This will ease away the tensions and increase the blood flows to the legs. Your back has the most acupressure points. Each point has a direct energy connections with the organs, muscles, meridians, tissues, and joints. Divide your body into 3 sections, from the lower back to the middle back and from the upper back to the shoulders. Each sections work on 10 to 20 seconds or until you find the tension spots dissolved.
Hi, hello, my name is Yuki. So I'm working in the banking industry. Get to know about myofascial through Agnes, right, which is also one of my yoga instructor. Because of Agnes, educations in myofascial, I get to know more about this, and I really into it nowadays. Like I always have like tight around my neck area, shoulder, which I believe that it directly cause my migraine, and also like I also have a lower back issue as well. Right, so the myofascial programming actually helped me in release my muscle tension as well as my connective tissue, and then my trigger point as well as the pressure point. Right, I feel like I was completely released, and then like feel like zero tensions. Yes, and I feel like I was reborn. Yeah. So I really love myofascial.
So how to get your energy moving without the fascia ball? This is a special tip you can do anytime when you experience aches and tension. Always stand up after 2 to 3 hours of sitting at the desktop. Simply pack on your lower back with pressure between 1 to 10. Give it a hard pat of up to 10, followed by a non-stop spiral twist at your torso. Crunch your feet and tap on your acupressure points of your Yao Yu, Jian Yu, and Pi Yu Xue. Repeat these movements for about 50 to 60 times. Place your left hands over the right shoulder, crunch your feet with the right hand, and gently tap on your underarm, which is your Jian Zhen Xue. Activate your lymph node and allow the blood to flow through the vessels of the arms to the armpit. It will also release your circulations and prevent any build-up cells that form a lump in your armpit and thus becomes a cancer cells. And repeat over the other side. Twist helps a lot in your digestion. Hook the elbow towards the opposite knee, engage your core, and rotate your spine towards the back, looking at the back, and change it over to the other side. Repeat this for 6 times. If you're unable to hook the elbow at your knees, you can simply place your palms over your knees. Shake your fingers, wrists, and arms to loosen up the tensions and stresses from the overuse of your keyboard. Continue to work on this for about 40 to 50 seconds. Turn your arms facing upward and pull your wrist towards you. Change it over to the other side and hold there for about 60 seconds. Reverse your arms by facing downward and pull the fingers towards you. Next, rest the base of the palms and point the fingers towards your body and gently hold your elbow. Hold that for 60 seconds and repeat the other side. Interlace your fingers and tuck your chin to your collarbone and round your upper back to stretch your upper trapezius. And lock your fingers and raise your arms towards the sky and lengthen through your spine while you interlace your fingers and open up your chest and your shoulder blades and roll your body forward for a nice forward bend and try to open up the shoulders as much as you can. And repeat this for 5 to 6 rounds. Cross the left elbow towards your right and use your right arms to pull your elbow towards your chest. Repeat over the other side. Hold there for about 10 seconds on each side. Next, point the elbow towards the sky and allow the elbow to go right behind the ear to open up your chest and the shoulders. Repeat over the other side and hold there for about 60 seconds. Place your palms on the shoulders and go on a full range of shoulder rotation. Repeat this for about 10 to 20 times. Reverse the directions and ensure that the bicep pass through the ear for that range of motion. Neck massage helps to relax your nerves and fascial tissues at your cervical. Use your thumb knuckles and massage your fengci acupressure points and slowly move to the middle of the neck and at the 90-degree angles of your shoulders and neck joint. Use the dapping method with 5 fingertips joined together and dap it gently at your da tray, which is at your C6. and use your both palms to pat on the base of the skull to vibrate the energies and release the trapped chi at the back brain, which may cause migraines or headache. Resting on an elevated yoga block will open up your compressed vertebrae and relax the fascia tissues. It will also enhance your cerebrospinal fluid and open up your rounded shoulders. If you haven't tried myofascial class, try it.